Welcome, everyone. Thank you for joining us. My name is Carlita, and I'd like to welcome you to today's webinar. CHAT is the leading resource on ADHD, and we provide training, education, and advocacy for 17 million children and adults throughout the United States. Next slide. Next slide. With the right support, each individual with ADHD can be successful, and I invite you to become a member of CHAD. With membership, you have access to resources and benefits. Please join CHAD today. Today's webinar is brought to you by Supernus Pharmaceuticals. During the webinar, we would like to hear from you, so please ask questions and share comments at any time during our presentation. All you need to do is type your question in the question box, and we will be answering questions at the end of the presentation. If we don't get to your question today, we do have health information specialists that are available Monday through Friday between the hours of 1 and 5 p.m. Eastern Time. You can reach our health information specialist at 800-233-4050. And now it is a pleasure for me to introduce today's presenters, Dr. Andrea Cronus-Toscano and Dr. Michael Christopher Meinzer. Dr. Cronus-Toscano is the president-elect of the International Society for Research in Child and Adolescent Psychopathology, the associate editor of the Journal of Consulting and Clinical Psychology, a fellow of the Association for Psychological Science, a fellow of the Association for Behavior and Cognitive Therapies, a former associate editor of the Journal of Clinical Child and Adolescent Psychology, as well as a scientific advisor to NIMH Outreach Partnership with the state of Maryland. She is the recipient of multiple NIH grants and has served on several NIH review committees relevant to developmental psychopathology and interventions. Dr. Cronus-Toscano currently serves as an advanced professor for the College of Behavior and Social Sciences at the University of Maryland. Dr. Meinzer graduated from Boston University with dual degrees in human physiology and psychology. He pursued his graduate work at Florida International University, where he completed a master's in physiology and a doctoral degree in clinical science in child and adolescent psychology. He was honored as the Worlds Ahead graduate. Dr. Meinzer completed an APA-accredited internship at the Medical University of South Carolina and a postdoctoral fellowship with Dr. Andrea Cronus-Toscano at the University of Maryland. I am honored and pleased to introduce today's presenters, Dr. Andrea Cronus-Toscano and Dr. Michael Meinzer.
Hi, we're so happy to be here today to talk to you about a critical developmental transition period for individuals with ADHD. As many of you know, ADHD is a disorder that in most cases spans a lifetime. And we've become more and more interested in college students with ADHD because this is a time when all of the supports afforded by parents and peers and teachers precipitously drops off. So what do we know about college students with ADHD? Well, as I mentioned, ADHD persists in most individuals identified with ADHD during childhood. Although the difficulties faced might vary, there are still some challenges associated with ADHD. And whereas at one point in time, college was not an option for many individuals with ADHD, today about 2 to 8% of college students in the United States report clinically significant levels of ADHD symptoms. Now, those rates depend on how ADHD is assessed. But the current view is that about 2 to 8% of college students have ADHD. But interestingly, about a quarter of those who receive disability support services receive services for ADHD. meaning that this is a major issue on college campuses. However, our experience also suggests that many students with ADHD are reluctant to obtain disability support services or accommodations in college, which can greatly impact their functioning academically. So, what do we know about how college students with ADHD function and what type of difficulties they experience? Well, first of all, we know that compared to those without ADHD, as well as those with other learning difficulties, college students with ADHD have lower grade point averages. They are less likely to complete a college education, despite the fact that those who do attend college have higher cognitive abilities, have done better in school to this point, and have better coping skills than those who do not. But we also know that parents and teachers provide a lot of support, which help high school students eventually make it to college. And so in college, things are much different because, of course, the context is different and the expectations are different. So college students with ADHD tend to struggle with time tests. They have a hard time completing their tests and assignments on time. They say that it takes them much longer to complete assignments and that they have to work much harder to get good grades. Um, at the same time, the way that college is structured really requires college students with ADHD to structure their own time. They might have a class in the morning and then another class in the late afternoon, and they have to decide how to manage their time and when to study, etc. Um, we also know that college students with ADHD have a hard time pulling out the main ideas, both from their readings as well as from lectures. They have poor test taking strategies, poor study skills and habits. They'll often tell us that they don't know where to begin in terms of studying. Um, and oftentimes, procrastination plays a major role here, whereby many college students with ADHD may wait until the last minute to study for an exam, but yet at the same time, they have a harder time sitting to study for a long duration. So, this poses a particular challenge. And as I said, these problems distinguish ADHD from college students with other learning disabilities. And when we look at the different constellations of ADHD symptoms, the inattentive symptoms versus the hyperactive impulsive symptoms, it seems to be those inattentive symptoms that make it harder for college students with ADHD to do well academically in college. We know that there are also social functioning difficulties that these students face. So, as I mentioned before, a major issue with this developmental transition to college is that parents are often very hands on with their middle and high school students with ADHD. And so now this transition of support really moves from parents to peers. And this happens somewhat in high school, but now in college, their parents aren't there to check up on them in terms of how they're doing academically as well as what's going on for them socially. We know that college students with ADHD have poorer social skills, lower self-esteem, and they have a harder time sort of adjusting to new situations like college. In terms of dating, they achieve dating milestone later. They have fewer steady dating relationships, and they're less comfortable in the dating arena. But overall, as opposed to the research on the academic functioning of college students with ADHD, we know much less about their social functioning. Although many college students don't drive on campus, we do know that in young adults with ADHD that there do tend to be more car accidents at as the driver, a higher likelihood of drinking and driving and being arrested for drinking and driving without a license or registration, engaging in street racing, and other risk behaviors in the driving realm. Now, there's been much focus recently on the mental health of college students. And college students with ADHD are actually at much higher risk of other comorbidities or other conditions that might come along with ADHD. Our research has shown that about 60% of college students with ADHD have a history of major depression. And we know that anxiety also is highly prevalent in college students with ADHD. And our experience suggests that this really seems to be fueled by avoidance of tasks that require a lot of effort, as well as procrastination. So, what we see in many of the students that we work with is that they avoid their schoolwork and procrastinate till they get to the point where the task at hand, either the paper or the exam that they're studying for, feels unsurmountable. And at that point, they become really, really anxious about their ability to get the work done, which in fact may be accurate in some regard because our experience suggests that students with ADHD, because they may not be able to sit and focus on an assignment or in studying for more than a half an hour or so at a time, by starting the night before the exam or a couple days before the exam, they're going to have a much harder time making it through all of the material that they need to succeed. And so, as we'll talk about through this presentation, we really work very closely with college students with ADHD to take a more active, action-oriented approach rather than avoiding and procrastinating on their work and other tasks. Drinking and substance use is unfortunately part of the college context. And so, being in this unsupervised environment away from parents, where there's alcohol and other drugs, is part of many social uh, opportunities or activities. What we see is that college students with ADHD are much more likely to engage in tobacco use. Um, they may drink and use marijuana at high rates. But our research actually shows that they don't use alcohol or marijuana at higher levels than college students without ADHD, but they do seem to experience more negative consequences from alcohol and marijuana than their non ADHD peers. And this may be a function of the fact that they were already struggling academically and in some social domains, and adding the use of substances exacerbates some of these problems. So, what we want to tell you about now is our program called Succeeds at the University of Maryland, and the treatment approach that we take to try to address some of these difficulties that college students with ADHD face. And now I'll turn it over to my colleague, Mike Meinzer.
Hi, everyone. So at this point, we're going to talk, as Andrea mentioned, about the different components that make up our Succeeds program at the University of Maryland. However, you may be familiar with a lot of these components as they are, and we try and fuse all of these different elements, such as psychoeducation, motivational interviewing, behavioral activation, organizational skills training, and cognitive behavioral strategies to really address the individual needs of each of the students that we work with at the University of Maryland. So first, I'd like to talk a little bit about the ADHD psychoeducation piece. So surprisingly, a lot of the students that we work with may have been diagnosed since they were a child, or some of them may be diagnosed in high school or even during their first semester of college. And even the ones that have been diagnosed since childhood, a lot of them are really unfamiliar with the terms about ADHD, what causes ADHD, and that there are cognitive behavioral strategies available to them, aside from just pharmacological interventions to help them manage their ADHD symptoms. So during our first session with our students, we use assessment data that they've filled out we use the Barkley ADHD adult ADHD rating scale, the bars. However, any ADHD rating scale would suffice, and we present them with their data in terms of the percentile of ADHD symptoms that they report, and walk them through, what kinds of symptoms, tend to cause the most difficulties for them in day-to-day life. Um, we also kind of uh, have discussions about the causes of ADHD and that it's neurobiological and genetic in nature, as well as I mentioned, the different treatments that are available to them. And we do this in a motivational interviewing style. So rather than lecturing them and having it feel like another class that they're taking, we really make it a conversation and ask them what they know about ADHD, and asking permission to share, fill in the gaps for them in terms of the things that we know that they might not be familiar with. So in addition to the ADHD symptoms and percentiles that they report, we also have them complete a scale of adult ADHD impairment. And the scale that we use is the Weiss Functional Impairment Scale, the WIFIRS, WFIRS. And it has a bunch of different domains, such as daily. And we've also used the Barkley Functional Impairment Scale as well. But what we tend to use breaks down the different domains into categories like daily responsibilities, how they manage their money, their relationships with family, friends, and romantic partners, their education or their career, and how ADHD impacts each of these different domains in their daily life. So again, in that motivational interviewing style, we ask them, based on your self-report data, you fell in the, for example, the 98th percentile. How do you feel about that in terms of your difficulties with education? What kinds of things were you thinking about when you were filling out this questionnaire in terms of your educational difficulties? And having a discussion with them about how ADHD impacts their daily life. So this is just a screenshot of our feedback form. So as you can see, we present them with their scores as well as compare them to a normative young adult sample, and provide them, have this be the start of the discussion in terms of, what types of symptoms they feel like they're reporting, how it compares with peers, and how these symptoms impact their daily life. So this is the Weiss Functional Impairment Scale, as I mentioned. So based on their self-report on this scale, we indicate the areas of their life that they reported the most impairment in, as well as the areas of life that they reported being least affected. And the reason we do that is to also emphasize the strengths that they have that got them to college. So, for example, in this case, family was one of the least impaired areas. So, really emphasizing, that they have strong family support, and how they continue to maintain a strong bond with their parents or their siblings while they're away at college, and emphasizing those strengths as well. And then again, in each domain, we indicate the different items that they've reported, and have a discussion with them about, talk to me about what problems taking notes looks like, or what getting your work done efficiently looks like, so that they can talk about the different difficulties that they're having in an open space, and really control the dialogue. So following the feedback is where we set up the intent to change. So asking them, after we've gone through all of this, what do you make of this feedback? Is there anything that you want to change regarding your day-to-day life at the University of Maryland or whatever college they're at, to be able to make changes in their life? And as I mentioned, we also want to focus on the strengths in their daily life as well, so that this feedback session isn't all negative and all about the areas of life that they're struggling in, but also building them up and talking to them about the things that they're also doing well. We also try and get an idea of their values and their goals, both short and long term during this session, which will be really important when Andrea talks about the behavioral activation piece in just a little bit. So just to give you a basic background in motivational interviewing, we tend to follow the ORS framework here. So open-ended questions, again, letting them kind of control the situation and not giving them, forced choice answers where, the dialogue might be shorter, we're leading them in a certain way, but really allowing them to elaborate on the areas that we're asking them about. Affirmations, which is kind of like a souped up version of praise. So rather than just praising behavior, we're identifying different values that the client has and praising those values. So rather than just saying, it's great that you, contact your parents, on a weekly basis, saying, it's great that you hold family so strong and dear to you, and that you are really, caring about how your parents are. So rather than just praising that behavior, affirming them, their values. We also do a lot of reflections to ensure that the client understands that we hear them, and and also to make sure that we're understanding the information they're providing us correctly. And then summaries. So after they may elaborate on the fact that it's hard for them to sit down in the library because there's lots of distractions going on, and they end up pulling out their computer and getting distracted by the internet, summarizing everything that they're saying, and feeding it back to them so that they can kind of hear their thoughts said to them out loud, which our students have indicated is really helpful for them. So we also tend to use decisional balance if we have students that are engaging in problematic substance use or alcohol use. So we'll provide them with similar feedback, which I'll show in just a few slides here. But asking them, what are the pros and cons of changing behavior? So it could be related to drinking, or it could be related to, watching Netflix for 4 hours on a Tuesday night before they have to wake up for class early the next day. And allowing them to not only talk about, the negatives of that, but also the pros. And I think students find this really helpful, that, you're not just telling them to not do something or telling them what to do, but really having them list the reasons for and against this behavior change. So in this example, a student, you may say back to them, on the one hand, it can be really hard for you to plan additional time to study for your tests. But on the other hand, your grades are really important to you. You want to get into graduate school after you graduate from undergrad, and you want to avoid having to repeat this class. So where does this leave you now? In tossing the ball back to them. As I mentioned with that in the ADHD psychoed piece, rather than just lecturing them on the symptoms of ADHD and the causes, using this elicit, provide, elicit framework. So asking them, what do you know about ADHD? And allowing them the chance to talk about, what their familiarity with ADHD is, and then asking them, would it be okay if I told you a little bit more about that, or some of the things that that I may know about ADHD, and then providing that feedback. So again, you're getting their permission to share more of this information with them. So just as we do with the ADHD feedback, if we have students that are engaging in alcohol or marijuana use, we do a substance use feedback session as well, where we again reveal the number of drinks that they have compared to other college students, an estimated BAC on heavy and light drinking nights, and then the consequences they face in terms of their alcohol use or marijuana use. But I think one of the most important things we do before we get into that feedback is asking them, why they like drinking, or why they like smoking marijuana, or what are the good things about it. And in addition to the negative things. And I think that, A lot of times students are caught off guard that, we're asking them about the positive aspects of their substance use. And the reason we do that is because we want to help them maximize the positive aspects of it and minimize the negative aspects of it. So again, it's not that we're endorsing underage drinking or substance use, but rather, we know the students are going to do it regardless of whether we tell them not to. So rather than having it be a just say no lecture, we're trying to minimize risk. So it's a risk reduction strategy. So if we can help them, maybe curb the number of drinks that they're having, or, maybe sticking to beer instead of hard alcohol, if that's something that tends to cause consequences for them, we're reducing the risk of having more negative consequences. So again, we use this motivational interviewing framework. And then here's another screenshot of our alcohol feedback. So we can show them based on the number of drinks where they fall compared to other college students. So, we have some students who only have a few drinks per week, and we don't typically spend time doing a whole alcohol feedback session. But when we have someone who's endorsing having 30 plus drinks per week, and they're in the top 4% of college students, we find that this is a really good use of time to help, again, reduce the risk for negative consequences associated with their substance use. So in addition to just talking about the level of drinking, we also talk about the things that they report having happened in the last 6 months when they're under the influence or after they've been under the influence of alcohol or substances. So it could be, we break it down again into different domains. So whether it's social domains, like having done or said embarrassing things, whether it's affected their schoolwork, or whether it's affected how they feel about themselves. And these are just a couple of the different categories that we break consequences down into. And again, just like we do with the ADHD feedback, after we kind of summarize the experience and what we've gone over, we ask them, what they make of all of this and where they are in terms of, making any changes related to their drinking. And we try to also do this by relating it to their values that they mention in the ADHD feedback session. So, if one of their values is being, a reliable friend, and they're reporting that when they're under the influence, they often fail to show up for events with their friends the next day because they're hungover. We try and relate it to that. So, how does your drinking influence your relationship with your friends and being, a trustworthy and reliable friend? So bringing it back to those values that they mention are important to them. And then setting specific observable goals in terms of their substance use. So at this point, I'm going to toss it back over to Andrea so that she can talk about the behavioral activation component of Succeeds.
Thank you. So before I do that, I just wanted to reiterate, what Mike said in terms of our focus on motivational interviewing techniques. I think it's really important to think about where college students are developmentally and the fact that college students with ADHD are sort of stuck in this position where they want to be independent. They're going off to college and they really don't want anyone sort of telling them what to do necessarily. But yet we are trying to motivate them to make important behavior changes. So, how do we do that? And that's really why we use motivational interviewing techniques. In addition to that, some people ask us, well, why are you focusing so much on substance use? And when I talk about this next phase of the treatment, it's important to keep in mind that individuals with ADHD are much more likely to be motivated by things that bring instant gratification. And so substance use can often be thought of or felt to be more instantly gratifying than the kinds of long-term tasks that are required to do well in college. So behavioral activation is a really great way or a great method to get college students with ADHD involved or engaged in more rewarding activities that are alternatives to substance use. And at the same time, the focus is really decreasing engagement in activities that are either not productive, unproductive activities like scrolling through your phone, binge watching Netflix, playing video games all night, um, or other activities that are just not enjoyable or even harmful, like substance use. So, what we're trying to do in behavioral activation is to help college students with ADHD lead healthier lives while addressing some of the impairments that they face in other domains. So, we started out talking about the difficulties that college students with ADHD have academically. And so, methods that are used in behavioral activation help students with ADHD to break down tasks like academic tasks, career tasks, making sure that they're scheduling fun things to do with other people that don't involve substances, ideally, so that they're actually working on the areas in which they're having difficulty in a very purposeful way. So behavioral activation is a set of strategies that involve monitoring daily activities. So the only way that we can help college students with ADHD to structure their time to live a healthy and productive life is by seeing how they spend their time. And so for the first week of behavioral activation therapy, we'll actually have college students with ADHD monitor what they're doing hour to hour every day. And there are different apps that this can be done in. There's a behavioral activation app, or we've had a lot of success just using Google Calendar on their cell phones to be able to give the therapist a window into how they're spending their time. And then we look at these activities and we really have them reflect on how much pleasure that they're getting from these different activities that they're engaging in, how much sense of mastery they derive from it. And what's important about these two things is that we know that people feel better, that your mood is better when you're doing things that you really enjoy, that are meaningful to you, that help you feel like you are being competent and productive and getting things done. And so what we do is we start out after monitoring by scheduling with the students activities, and we break them down so that they could feel a sense of pleasure or mastery. So for example, if a student was, a soccer star in high school and now through the process of monitoring realizes that they're just spending a lot of time vegging out in front of the TV or, playing a game on their phone or playing video games, and they're not really involved in any athletic activities that help them to feel good. What we will do is we'll have them actually schedule activities and get involved in things like clubs, etc., so that these things are actually on their calendar and they're doing things that help them to feel good. Similarly, with academics, we might have someone, say that they have an exam in 2 weeks. We might actually, through the process of behavioral activation, have them schedule a 30-minute study session every night leading up to the exam. And so the idea is that by doing things that you enjoy, that bring you pleasure, you're going to feel better. And we also previously talked about a lot of overwhelmed feelings associated with the procrastination that really characterizes ADHD. So by chipping away little by little and scheduling and breaking down complex tasks, students with ADHD will feel much better and less overwhelmed. So behavioral activation really focuses on not avoiding tasks or not avoiding activities, but rather purposely scheduling activities that are productive and bring pleasure, and help the individual to live in line with their values. And Mike will talk a little bit about values shortly. But the other thing that we do is we focus on reinforcement, um, which in college students often takes the form of self-reinforcement. Okay, so many of our behavioral interventions with younger kids involve parents and teachers providing rewards or reinforcement for the kids doing the activities or behaviors that we want to see them doing. Well, when we become adults or when we're independent or moving off to college, it's really up to us to reward ourselves. So many of us might at work say, okay, when I finish this report, I'm going to go get myself a coffee or a Starbucks or something like that. Or, after I finish the dishes, I will sit and watch my favorite TV show. Well, we try to encourage and teach our college students with ADHD to do the same type of thing. So if they sit down for a 30-minute study section, they can reward themselves by getting a snack or going out with friends or watching their favorite Netflix show for one episode or something like that. So rewarding yourself for those, even for those small successes. Okay. And so I mentioned monitoring, and monitoring, of course, can be challenging to get students with ADHD to do that. Um, but the process of monitoring is really important because when we monitor our activities and our mood, we really get to learn about what behaviors or activities help us to feel better and which activities that we might be spending a lot of time on in our lives that are really not very enjoyable, not fulfilling, and really don't leave us feeling very good. So a lot of those are sort of the time wasting things. And so, what we eventually try to get the students to do is to recognize, are there certain things that help me feel great? And so, for example, for a lot of people, getting outside and getting physical activity helps them to feel much better. So then we would set goals to increase that. Same with sleep. Getting 8 hours of sleep can have a tremendous impact on many people's moods. And so, we also, will set goals related to that using the principles of behavioral activation. Okay, and also in terms of thinking about different activities that someone can engage in, thinking about how important is this activity for me in my daily life? Is it not very important or is it really important? Okay, so for those of us who are adults, examples of important activities might be taking your kids to school, making dinner, going to work, making a doctor's appointment. For college students, it might be getting an assignment done, getting some exercise, spending quality time with friends. Um, and so the activities, it's very important that the activities that we schedule fall in line with their values. Um, the activities, not only do we ask how important is this activity to you, but how much pleasure does it bring you? A lot of times we spend time doing things that really don't bring us much pleasure. And so many of the students that we work with actually set goals to reduce these kinds of behaviors. And again, the kinds of things I'm talking about are playing video games for hours. Maybe it was really pleasurable for the first 30 minutes, but after that first 30 minutes, they're really diminishing returns. This is an example of a paper copy of a monitoring form. However, we also use monitoring forms that are online on the cell phone. And then Mike now will talk about the different life areas that we focus on in relation to our behavioral activation intervention component.
So what we try and do with our students is identify that, there's we could break down life into many different areas, but we tried to compartmentalize it into 5 different ones. So relationships, whether that be with family, friends, or significant other, school or their career, hobbies, recreation, volunteering, mind, body, and spirituality. So here we talk a lot about self-care, whether it be like hygiene or taking their medication or eating healthy food, things like that. And then lastly, daily responsibility. So maybe it's doing the dishes that are, an activity in this area could be like doing the dishes that are piling up in the sink or taking care of chores, things like that. So within each of these life areas, we try and identify a value. And I'll show you a nice example of a flow chart here in a second. And when we talk about values, we're thinking about an ideal or quality or strong belief you have for a certain way of living. So a lot of times what we talk with our college students about is if someone were to write a recommendation letter for you or present you with an award, what would you want them to say about you in terms of your education or in terms of your relationships? And so identifying those values. So it could be that they want to be a successful college graduate or be a good or kind or caring friend, to be more involved on campus. And from there, within each value, we break down values into specific observable and measurable activities. So if one of their goals is, they want to start exercising more, or being more fit, an activity could be, going for a walk, and or maybe they want to improve their mood, and so getting out and going for a walk might be a helpful activity. Thinking happier thoughts would not be an activity because this isn't something that's observable and measurable. And the reason we want things to be observable and measurable is so that we can actually schedule them in the Google Cal or Apple Cal or in their paper and pencil calendar. Whatever method they feel is going to be able to keep them on track, in completing these activities, we roll with and we go, we meet them where they're at. But we just want it to be an activity that we can actually schedule and put on the books. Um, and so once activities are selected, they become the focus as opposed to a value. So we're working towards completing those activities in line with those values. And these activities should be something that's enjoyable or important or both. So as Andrea mentioned before, there's activities that are, enjoyable or important and important. Like, maybe meeting friends for dinner to catch up on what's been going on during the week. There might be activities that are enjoyable but not important, like playing video games. There might be activities that are important but not enjoyable, like getting your homework done. And there also might be activities that are neither enjoyable or important that we find out about as we're monitoring. So as Andrea mentioned before, like scrolling through Instagram mindlessly or Facebook, or binge watching Netflix and not really getting any return on having watched those episodes. That might be an activity that's neither enjoyable or important because your mind's not really in it, and there's a point in time when it's no longer enjoyable. So we want to try and identify activities that are either enjoyable or important, or ideally both.
And actually, I'm just going to insert for 1 second and tie this back to the fact that we mentioned that, the transition to college is a risk period for the onset of depression or depressive episodes, and that behavioral activation has also been shown to be a highly effective treatment for depression. So by keeping the students engaged in productive and pleasurable activities, not only are we addressing some of the ADHD related procrastination, but we're also preventing depressive symptoms as well.
Yeah, that's a great point. So this is the flow chart that we use with our students, and we actually give them worksheets that have these the words actually taken out, or space for them to be able to fill these things in. And we keep a copy and then also have them take a picture of a copy so that they have something in their phone to remind them what they're working towards. But we also can keep it on file in case for some reason it gets misplaced. We have a copy to ensure that we can keep them on track in terms of the activities and values that they're working towards too. So here are some examples. I'm going to quickly go through these so we can just we have time for some questions. But as you can see, we have we can identify different values for the different life areas and activities that will meet those values. So if they want to get good grades, what are some specific and observable things that they can do? Well, maybe going to that 8 a.m. class or reading the textbook for 30 minutes every day, attending the office hours once a week, or going to the Office of Disability Support Services and enrolling for accommodations. So I'm not going to walk through all of these, but there are some examples for each of the life areas here that you can peruse. But I wanted to talk about kind of some take-home tips for what Andrea and I have found work well when working with college students with ADHD. And so just to kind of summarize some of the things that we've talked about, using a calendar system or reminders. Again, that can be Google Cal or Apple Cal or paper. Some of our students still like carrying a physical planner. So whatever it is that they want to use, meeting them where they're at and really helping them use that system to stay organized and schedule those activities. Using a to-do list and prioritizing what they need to get done. So trying to figure out, what are the most essential or critical pieces of homework or things that they need to get done, and making sure that those are the first things that are scheduled. Breaking things down into smaller, more manageable chunks. And so that I think is inherent to behavioral activation. So, we're breaking down our values into different activities. And so if we're breaking down activities into actual realistic things that they can accomplish, then we're setting them up for success. I think one of the main things that we do with our students as well is helping them at class registration time to make sure that their class schedule is going to set them up for success. So scheduling, 3 one-hour classes back to back to back may work for some students, but for other students, they might be burned out by that second or third class. And so making sure that their class schedule sets them up for being able to pay attention and be successful. And it also might be important to schedule classes or studying or getting things done for times when they're not feeling tired and when their meds are active if they're taking stimulant medication. So I'm going to toss it back to you, Andrea, to finish out these last top 10.
Yeah, taking their medications as prescribed. So there have been some new papers coming out showing that college students don't take their meds regularly. And of course, whereas, we believe that teaching skills is an important adjunct to medication, just taking your medication regularly can really go a long way. And there are many apps that help people remember to take their medications. There's emerging research coming out showing that exercise can have strong effects on executive functioning and mood. So making sure that they're getting exercise, and exercise can also have a social component if they join some sort of intramural sport or club. Eating healthy meals, which often goes to the wayside in college, making sure that they're getting fruits and vegetables and all of that. Sleep is another major recommendation for everyone. Of course, we all feel better and we can think more clearly when we get enough sleep. And certainly the sleep schedule of most college students with ADHD is quite erratic. So again, there are apps that can help to remind someone to get to sleep at a certain time and to maintain a regular sleep-wake cycle. And this is part of behavioral activation. Again, scheduling when to go to bed, scheduling when to get up, etc. As I mentioned before, it's really important for all of us that when we achieve a goal, no matter how small the goal is, to be able to reward ourselves for our achievements. So rewarding oneself for completing a report or for studying for their 30 minutes a night or whatever it is that they've set up as a goal for themselves. Number 9 is to not be afraid to ask for help or support from family and friends, but also not being afraid to get accommodations on campus and to see what the college offers for students who are neurodiverse or who have ADHD. Our experience is that the majority of students with ADHD are reluctant to do so when it could really be helpful. And then number 10 is to really use all available resources, including staying in touch with a therapist, getting a new therapist on campus, and also finding out, as I mentioned, what the college has to offer for students with ADHD. Here's our contact information. We'd be happy for you to visit our website to learn more about what we're doing in the Succeeds Clinic and also to follow up with us if you have any questions.
Great. Thank you so much for your presentation. This has been a webinar that has been provided by Supernus Pharmaceuticals. The information you have given and shared with us is great. Let's jump straight into our questions. We have about 5 minutes remaining, so we will take several questions and then we can wrap up the webinar. How do you help students understand the value of a planner and/or calendar?
That's a great question. We have many students who are very resistant to using these. Again, the motivational techniques are really helpful in terms of promoting behavior change. Oftentimes, we will present this idea to students who are reluctant to use a planner, but then eventually come around when they notice that it's actually very overwhelming to juggle their several different classes. We start out the semester by having them bring in all of their syllabi into the session and putting key due dates on their calendar and then working backwards to identify intermediate goals for the various projects in their classes. It would be very hard to keep track of all of that without a planner. So sometimes, for students who are resistant, we might start out with a prioritized to-do list that includes deadlines and things like that. But most of our students do eventually come around to to that idea of a planner. Do you have anything to add to that, Mike?
Yeah, so I think that, as Andrea mentioned, the motivational interviewing techniques can be really helpful. So asking them, what are the pros and the cons of using a planner, and having them outline it that way. And if they're still seeming kind of resistant about using it, saying, well, how about we give it a 1-week trial? And I want you to try this for 1 week, and we'll talk next week and see how it worked. And then problem solving from there and figuring out a way that we can meet them where they're at and try and, maybe figuring out a different app or going to a paper and pencil planner. But again, kind of letting them try and control or take the lead in terms of what exactly they want to use. But kind of having it be, well, let's just try this week and then we'll go from there.
Yeah, we could frame it as an experiment that they'll give it a try. We also ask them sometimes how their current methods are working for them. And with motivational interviewing, if they express any interest in being more organized, we reflect that, and then we again suggest the planner as a way to help them feel more in control.
Okay. Our next question is wondering, can you provide some of your favorite apps that you use with students? Can you share any of the technology that might be helpful?
So, as I mentioned, behavioral activation has an app that's associated to it called behavioral activation. Um, that is helpful in some regard, but with most of our students, we actually use Google Calendar because Google Calendar allows you to put in recurrent activities like a class or a club that meets on a regular basis. They could also set different alarms to go off like 10 or 15 minutes before the activity. Um, you can also set goals in Google Calendar. And the nice thing about having the calendar on your phone is that most college students don't, go everywhere with their phone. They always have it. So that's why we like that. Other people have suggested to us Pomodoro as an app that is helpful in terms of making sure that you're staying on task. Um, and then there are medication adherence apps that people have had really good success with. And I would just go to the App Store and plug in, medication reminder or medication adherence and see what comes up.
Another cool app that a lot of times actually the students are the ones that will alert us to some of these new apps too. And there's one called Flora, which essentially helps friends stay focused together. So essentially you and a friend have to um, keep your phone on this app screen. And if you go to another app and it can like a Facebook or Instagram app and get distracted, then it actually kills your tree. And your friend can see that you're not on that. You're off of the app. So it's another way to kind of find a friend to help keep you accountable.
The parents of my high school students are very close and interactive. It seems as though I'm trying to get the students to take on responsibilities to help themselves. Is there any advice that you can share or give to us that we can talk to our parents and let students advocate for themselves? And what do we do if students are resistant to receive accommodations from support services?
Yeah, so one of the major challenges is that parents are very eager to step back, and the students are very eager to have their parents back off. But the challenge is that they often need a lot of support. Um, so again, the motivational interviewing can be a really helpful technique to kind of help them to recognize what the strengths have been that have helped them get through, get this far, to get admitted to college, etc., and to see what level of support might be helpful in making this tough transition. And this is a big transition for everyone, not just students that have ADHD. So going from lots of support in high school to no support whatsoever is probably not that realistic. So kind of, again, this is the reason why we integrate the motivational techniques to try to get them to recognize that some level of help is usually going to help them do much better. And then we also talk with them about the fact that, if you can show your parents that you are able to do this and able to be successful with less, monitoring by them, then they'll feel more comfortable backing off. And we do some experiments, showing them how that can play out.
And I think with the accommodations piece, so a lot of it's fairly common that some students are hesitant to receive accommodations. And again, I think we've said this a bunch, but I think going back to that motivational interviewing framework and asking them, what do you think the pros of getting accommodations are, and what are the cons, and laying them out there for the student. I also have used the analogy because one of the students I've worked with said that they feel like they are cheating by using accommodations because it's giving them an unfair advantage. And rather than framing it that way, I try and frame it as that, imagine that you're not getting a head start, but you're being able to start at the same starting line in a race. So without accommodations, other students may be half a lap ahead of you, and you're putting yourself at a disadvantage by not taking the accommodations. Whereas if you enroll in the accommodations, you're starting at the same plane as these other students. And so why would you want to put yourself at a disadvantage? That's been helpful for some students as well.
Excellent. This will be our last question before we conclude. The question states, how can you get more specific information on how we can implement these strategies if we're solo or on our own at the school without resources?
Okay, so I'm not sure, is that question coming from a parent or a student? Is it clear?
It's not
Um,
actually clear, but I would have to say, can we take the perspective of an educator who wants to implement something similar to Succeeds in their institution?
yeah, no, that's a great, yeah, thank you. I would say that certainly, starting with a group, Succeeds, the way that we run our Succeeds program is by having a once a week group, as well as combining that with coaching sessions for up to an hour additional a week to help the students put some of these ideas into action. Um, so I would say, as a single provider um, at a university, I think that you can certainly run groups that infuse elements of these interventions. Into it, so like behavioral activation, for example. And we do have a manual, a variation on this manual that we can distribute. So if you email us, we can give you that information. But essentially, by running a weekly group, that is one way that you can begin to get some of those ideas out there in an efficient way, um, for college students with ADHD. A lot of these strategies can also be used on an individual basis, but of course, given the high number of college students on any campus with ADHD, you might not have the capacity to reach a whole lot of students at once, unless you offer this in a group format. But all of these ideas can be implemented on an individual basis as well. We've done it both ways.
Thank you. That is all the time that we have for today's webinar. I'd like to thank you for sharing your expertise, Dr. Meinzer and Dr. Cronus. I'd like to also thank you all for joining us and attending today. Please take a moment to answer our surveys and questions that will be coming to you via email and providing your suggestions. We value your input. We use them to make changes and identify topics for future webinars. Again, thank you for joining us. This concludes today's webinar.